Sure.
Yeah. Thank you so much.
Thank you very much for sure.
Yeah. Thank you so much.
Sure. So yeah. So I'm interested in using the retina to study the brain disease, especially dementia, aging related changes. So I'm the speaker. Actually, the work is from a big team from the University of Miami, including the Department of Neurology group and the Department of Sports Medicine group, and also Bascom Palmer Eye Institute Department of Ophthalmology group. We have been doing this work for years, trying to set up the method to study the retinal microvasculature and the macrovasculature study method, and try to interpret the brain change and degenerative neurologic disease, and also aging. So we don't have any financial disclosure related to this talk, but we have funding support from McKnight Brain Institute and also NIH. So we all know that normal aging increase the likelihood of hypoperfusion in the tissue, especially the neural tissue like brain and retina. The reason could be many, but the most possibly is cardiovascular dysfunction with the aging, and also maybe vascular itself stiff, less of comfort, decreased compliance, and increased wall thickness or other things, increased tortuosity. So the decreased perfusion in the brain has already been demonstrated in Alzheimer's disease, which showed global or focal cerebral hypoperfusion. Like this example, this is the arterial label spring MRI, which show this is normal control. This is patients with Alzheimer's disease. So patients with Alzheimer's, the red means hypoperfusion. So we can see easily from this picture that the Alzheimer's disease has more profound, patients with Alzheimer's disease have more profound hypoperfusion in their brain. And the other point is the retina and the brain, the vasculature, they share the same embryonic genital origin. So we think retina is the extension of the brain, and the vasculature of retina and the brain have the similar physiological and anatomic features. So, and also retina and the brain tissues, they are similar. They are all neuron tissues. They have very high metabolic activities, and they demand highest blood supply compared to other organs in our body. And meanwhile, they don't have energy stores. They really depend on the robust process that regulate blood flow to meet their energy demands. And also, the retina is a window of the brain, especially this microvasculature. We can actually microvascular network in the retina near the fovea area. So we can know this is the eye picture, at the retina picture. This is optic nerve head. There is retinal arteries coming out, retinal veins coming in, and they have various kind of branches. And this is the microvascular network in the retina near the fovea area. And this network, this microvascular network is very easy to access because the transparent ocular media, and also it's easy to measure and study. And actually, these microvascular changes, network changes, supposed to represent the brain microvascular changes, even systemic like kidney microvascular changes and the heart microvascular change. So it's a great tool to study the microvascular disorders in our body. So in this talk, I would like to first briefly review the methodologies that we set up in our lab to quantitatively measure retinal tissue perfusion, retinal microvascular density, and volumetric vessel density in the retina. Then I will discuss age-related retinal microvascular changes in normal people. And then I will present some very preliminary data of the correlation between the cognitive function and the retinal microvascular density from our pilot study. So first, let me discuss the methodologies that we use and that we set up over these years in our lab. So for the retinal microvasculature microcirculation study, first we used ultra high resolution OCT, which shows in picture here, which has a very high resolution, about 3 microns. So we know that the commercial available OCT, the resolution about 5 micron relatively. So the high resolution OCT has a very high resolution, and we can see 6 layers of retina. We all know that the retina has 10 layers. So in this, using ultra high resolution OCT, we can easily show 3 layers. It's volumetric data. So let me just briefly describe these layers. So first layer, we can see easily on the OCT is a retinal nerve fiber layer, which are the axons from the ganglion cells. The second layer is the ganglion cell and inner plexiform layer. These 2 layers, which are the ganglion cell body and dendrites from the ganglion cells, then followed by inner nuclear layer and outer plexiform layer and outer nuclear layer. And then we can see this photoreceptor and pigment epithelial layer as the last layer. So OCT, our ultra high resolution OCT, can do the volumetric measure of all these layers. And the other thing is, how do we measure the blood flow velocity in this microvasculature? So we also, this is just a cartoon, demonstrates the retinal blood supply, and we have inner retina layer, inner retina, that include mainly retinal nerve fiber layer, ganglion cell layer, inner plexiform layer, inner nuclear layer, and outer plexiform layer. These layers are supplied by central retinal artery. So they have central retinal artery and central retinal vein to supply this inner retinal layer, whereas outer retinal layer from the outer nuclear layer to photoreceptor and pigmental layer, there are no vessels inside. It depends on choroidal vessel perfusion to supply the blood supply in this, for the blood supply in this outer retinal layer. So we have equipment called the retinal function imaging that can measure the blood flow velocity in the microvasculature. And it's non-invasive, no contrast is needed. So we basically, it catches the hemoglobin in red blood cells. You can see these moving dots on this picture. On this slide are moving red blood cells, and the equipment can automatically calculate the blood flow in these teeny tiny vessels. So we can see the minus number is the blood flow away from the heart. It means that artery that supply the macular area, and the purple is the vein, retinal vein. That means the blood from the retina go back to the heart. So we can have all these velocities, retinal blood flow velocity, automatically calculated and demonstrated on the screen by the machine. We developed software that can measure the diameters of these vessels. So with the diameter and the velocity, we can calculate the blood flow in this macular area. And also our ultra high resolution OCT can measure the thickness, volume of this part of the retina. So with the blood flow, retinal blood flow volume plus the perfusion tissue volume, this part of retinal volume, we can calculate retinal tissue perfusion. We in short name RTP. So which is macular blood flow volume in this macular area divided by this part of the tissue thickness from the RF layer to the outer plexiform layer, which is the inner retinal volume. So we can calculate retinal tissue perfusion, RTP. And for retinal microstructure network density, we use the retinal, we use the optical coherent tomography angiography, which is also a non-invasive measure imaging of the retinal microvasculature. So we can see this OCT can, commercial available OCT can imaging the superficial capillary plexus, which shows here. And we know superficial capillary plexus sits in the retinal nerve fiber layer and the ganglion cell layer. And the deep vascular plexus can be also imaged by OCT. And we know this deep vascular plexus sits in the inner nuclear layer and outer plexiform layer. So similarly, so this is the imaging we catch directly from the OCTA. We call OCTA, optical coherence tomography angiography. Then using our software, we can extract the large vessels and also and skeletonize the vessels. So we only have the microvascular network remained for study. So this is the superficial. This column represents the superficial vascular plexus. This is deep vascular plexus. This is total inner retina vascular plexus. So similarly as the blood flow volume, and so we can use the density, which we use a software. We designed a software, we use a fractal analysis. We can get the retinal microvascular density, and we can divide the tissue volume of the corresponding area. So what we can get is volumetric vessel density called VVD. So it is the vessel density in the similar area, in this area, and divided by corresponding tissue volume measured by ultra high resolution OCT. So from this volumetric vessel density, as shown on the previous picture, we can have the volumetric vessel density of the superficial vessel plexus, which stays in the retinal nerve, fiber layer and the ganglion cell layer, and we can get the volumetric vessel density of the deep vascular plexus, which locates in the inner nuclear layer and outer plexiform layer. And also we can get the total retinal volumetric, inner retinal volumetric vessel density, which is the retinal nerve fiber layer, retinal vessel network density divided by total volume of inner retina. So next, let me talk about our study showed age-related retinal microvascular changes in normal population. So this study was published in IOVS. So basically we have 148 subjects, participants, healthy, totally healthy, and we separate them into 4 groups. G1 are the participants older than 35 years old. G2 is 35 to 49 years old. G3 is 50 to 64 years old. G4 is older than 65 years old. We check the retinal tissue perfusion and volumetric vessel density, and also we measure the tissue volume. So from this slide, we can see there is a parabolic curve shows up with all the participants. We can see all the participants with the red dot. So these are all the participants. And the participants older than 35-year-old is the red dot with the purple circle. So from all the participants, although it's not significant, but it shows a parabolic curve, a trend of parabolic curve that shows there is a turning point at around 35 years old. So we have increased retinal tissue perfusion. Roughly at about 35 years old, the retinal tissue perfusion started to decline. This is the same as retinal blood flow. It shows this parabolic curve, although not significant, but it seems the turning point is around at 35 years old. So we have gradually increased retinal blood flow until 35 years old, roughly, then gradually decline over the aging, during the aging. So the VVD, volumetric vessel density, we did not see such a obvious parabolic curves, but it seems there is a little bit decline with the aging. So for the superficial vascular praxis, it's interesting because there is an increased volumetric vascular density. And also for the deep vascular praxis, there is a decreased with aging of volumetric vessel density. And we can see maybe this is with this change is difference from the supervascular praxis and the deep praxis vascular praxis. Maybe it's because of the tissue volume also contribute. So we can see in the superficial, in the retinal tissue that is supplied from the superior vascular praxis, which is mainly the retinal fiber layer, ganglion cell layer, there is an age-dependent decline of volume of these two layers. Whereas in the INL, in the nuclear layer and outer praxiform layer, there is an significant increase of tissue volume, these two layers. And the combination effect showed there is no significant changes of the retinal tissue in the retinal tissue volume. So we think that because of this increased volumetric vessel density in the supra vessel praxis might be due to the decreased volume of these two layers of retina. Whereas here, maybe this is decreased deep volumetric vessel density, maybe also because of the increased tissue volume in the nuclear layer and outer praxiform layer. We have, this is another slide, basically showed similar findings. So retinal tissue, this is retinal tissue perfusion. We can see people healthy people older than 65-year-old has significant decreased retinal tissue perfusion. similarly as the retinal tissue blood flow, and but the tissue volume was not changed, was not significantly, is not significantly different between the age groups. And VVD, volumetric vessel density, it showed that similarly showed we can draw our attention here in the superpraxis. In the superior vessel praxis, there is an increased volumetric VVD, volumetric vessel densities, whereas in the deep vascular praxis, there is a decreased volumetric vessel densities, similar as our previous summarized data. And the retinal vessel, total retinal vessel density, if we do not consider the tissue volume, so there is significant decrease of the older people group, and significant decrease of the older people group from all these vascular praxis, whereas tissue volume in the inner retina, GCIP or unfair has slightly decreased in the older people, whereas in the inner retinal layer and outer praxiform layer, there is increased volume in the older people. So this is a summary table which showed that with aging, with those people older than 35-year-old, there is a change, decrease of retinal tissue perfusion about 0.47 yearly, and also there is a decreased vessel density. There is a decrease of 0.44. So, and these, they are correlated. The retinal tissue perfusion and the volumetric vessel density are correlated, and also in the different layers, in the superior praxiform layer, superior vascular praxis, the VVD is correlated with RTP, and in the deep vascular praxis, the VVD is also correlated with RTP. And more interestingly, compared to the other studies that did the brain blood flow volume in healthy population with aging, we found that our retinal data that we showed a yearly decline of minus 0.41, yearly decline of 41% is similar as the brain studies showed about 0.4% decline. I mean, around 40% decline in the brain. So that means the retinal blood flow changes may just represent the brain changes. So next, let me talk about our very preliminary study about the correlation between the retinal microvascular density and the cognitive function. So we recruited 420 cognitive normal. That means those people do not have any cognitive complaints. Their age range is 70.3 plus minus 4.6 years old. They are basically healthy, or some of them with controlled hypertension and diabetes. So we imaged them with OCTA, optical coherent tomography, angiography, and we measured the vessel density of retinal vascular network, superficial vascular plexus, and deep vascular plexus. And we also measured the cognitive function using MMSE and MoCA. And we use partial correlations to compare the retinal microvascular density and cognitive function. And very interesting, we found there is correlations between the retinal vessel density with the MoCA, with all the layers, like total retinal vascular density, superficial superficial vascular density and also deep vascular density. So that means maybe these retinal vascular changes can really represent the cognitive function changes in normal aging possible. So in conclusion, we think that the advancement of ophthalmic imaging facilities, that estimate of the measurement of the retinal tissue perfusion, retinal vessel density, or the volumetric vessel density is feasible and reliable. And also, there are altered retinal vasculature measured as retinal tissue perfusion and retinal vessel density may present the characteristic pattern of normal aging. And the retinal microvasculature